As Dr. Lynn mentioned, I'm Dr. Laura Petrillo. I'm a palliative care physician at Mass General Hospital and an assistant professor at Harvard Medical School. And I'll be speaking about symptom management and palliative care today. Please advance. So as everyone here knows, we are in a wonderful new era of cancer treatment, which leads to improved survival. And so for the longest time, the main approach that we had for dealing with cancer was surgery. And at a certain point, radiation came along, and then in the last century, chemotherapy. And only within really the last few decades have we had these new treatments that completely revolutionized cancer treatment. So as everyone in this group knows, targeted therapy is a directed type of treatment that targets molecular alterations in cancer cells and more specifically controls cancer growth than chemotherapy. And I also have on this slide checkpoint inhibitors, which you may be aware of as treatment for lung cancer. Please advance, Maria. Great. So with these really exciting new treatments, the reason they're so exciting is because they improve survival, and that improved survival is reflected in the decreased cancer mortality that we've seen. So this is sort of the gold standard for measuring how there's been improvement. So these are some graphs showing cancer mortality in the US broken down by gender, and you can see that cancer mortality has decreased. Now, there are a number of reasons that this has happened in recent years. In part, it's because of cancer prevention measures like decreased smoking, but it's also because of better treatment. And we can see in this graph, there's males and females mortality, and you can see that lung cancer has really declined. And all of this improvement in mortality means that there are more survivors. So the graph on the right shows the cancer deaths that have been averted by better treatment and people living longer. So the red is what might have been, and the blue is the actual mortality rate. So just showing that many more people are living longer, and that means actually also living longer with advanced cancer in addition to early stage cancers that are being detected earlier. Next slide, please. As everyone in this group also knows, cancer-directed treatment and the effects of treatment on survival are only one piece of the puzzle. Individuals experiencing cancer and their families have so many different aspects of that experience that are important to them. Their symptoms, the side effects of treatment, their emotions that they experience, the effect of cancer on their relationships, and how they understand their illness and what to expect. Those are all really important parts of their experience. And that's the focus of my research, trying to understand what people's experience is with living with lung cancer and cancer, advanced cancer in general. And then also trying to design supportive care models that reflect this new reality of what people are living with advanced cancer in the precision oncology era. Next slide, please. Ivy mentioned Jill Feldman, and so this slide is Jill's. You may have all seen this slide. This is Jill talking about some of the challenges of long-term treatment and kind of the mismatch between how people might appear when they're receiving effective therapy and getting great scan results and not looking like they have cancer to everyone else. The top might somebody might look at someone dealing with cancer and say, she looks great. And that might be how their care team and people around them perceive that they feel. But then in the red are all the different things that an individual might be feeling as they're going through cancer and cancer treatment, and just underscoring that the tolerability of these treatments is relative and determined by the individual. Kind of that experience, the main source of truth is how someone is feeling as they're going through it, and only they get to sort of have that say. So many thanks to Jill for sharing this slide.